Hi, welcome to my channel. Today I'm going to discuss the most important MCQs related to blood. So let's start our today video. Our first MCQ is, what is the main function of red blood cell? Our options are carrying oxygen, fight infections, produce hormones, or regulatory body temperature. So the right option is carrying oxygen. The main function of red blood cells are carrying oxygen in the body. Which blood types is considered the universal donor? Our options are type A, type B, AB, or O. So the right option is D. Type O blood is considered the universal donor. What is the liquid component of blood? Our options are plasma, platelets, hemoglobin, white blood cell. So the liquid component of blood are plasma. Right option is B. Which blood cells are responsible for clotting and wound healing? Our options are red blood cells, white blood cells, platelets, or plasma cells. So the right option is platelets. Platelets are responsible for clotting and wound healing. Which component of blood is crucial for the body's immune system? Red blood cell, platelets, hemoglobin, or white blood cell? So the right option is white blood cell. Is crucial for the body's immune system. What is the average lifespan of red blood cell in human body? 1 day, 1 week, 1 month, or 4 months? So the right option is fourth month. The lifespan of a red blood cell is 4 months, which is almost equal to 120 days. Which organ is responsible for the production of most of the body's blood cell? Liver, spleen, kidneys, or bone marrow? Which organ is responsible for the production of body blood cell? So the right option is bone marrow. Bone marrow is responsible for the production of red blood cell. Which of the following is not a function of blood? Transportation of nutrients in gas, regulation of body temperature, or production of digestive enzyme? So the right option is production of digestive enzyme is not the function of blood, while transport of nutrients and gases, regulation of body temperature is the function of blood. What is the primary function of red blood cell? It is also the primary and main function of red blood cells. Or option as blood clotting, fighting infection, carrying oxygen, or producing antibodies. So the main and primary function of red blood cell is carrying oxygen. Which component of blood is responsible for immune defense and fighting agent pathogens? Our options are platelets, plasma, red blood cell, or white blood cell. So the right option is white blood cell. White blood cell is responsible for immune defense. What is the process of blood cell formation called? So the process of blood cell formation called dash hemostasis, hematophysis, hemolysis, or hematuria. So the right option is B. Which blood type contains both A and B antigens on the surface of red blood cell? A, B, AB, or O? So the right option is C. AB has both antigen A and B on the surface of red blood cell. What is the term for an abnormally low red blood cell count? Anemia, leukemia, thrombocytosis, or hemophilia? So the right option is anemia. Anemia is the term for an abnormally low red blood cell. What is the function of hemoglobin in the blood? Transport of oxygen and carbon dioxide, or initiation of blood clotting, fighting infection, or absorbing nutrients. So, the function of hemoglobin in blood is the transport of oxygen and carbon dioxide. How does blood help in regulating body temperature? By, by producing heat, by absorbing heat from the environment, by constricting blood vessels, or by transferring heat between organs. So the right option is by transferring heat between organs. What is the role of platelets in blood? Our options are carrying oxygen, regulating blood pressure, initiating blood clotting, or transporting nutrients. So the role of platelets in blood is initiating blood clotting. The right option is C. Which blood component contain antibodies and plays a vital role in maintaining osmotic balance? Our options are red blood cell, white blood cell, platelets, or plasma. So the right option is plasma. Plasma contains antibodies and plays a vital role in maintaining osmotic balance. What is the name for a group of genetic disorders that affect the production of hemoglobin? Our options are leukemia, sickle cell disease, or thrombocytopenia. So the right option is sickle cell disease is the genetic disorder that affects the production of hemoglobin. Which blood disorder involved the abnormal proliferation of plasma cells? Lymphoma, multiple myeloma, anemia, or thalassemia? So the right option is multiple myeloma. What is the primary function of platelets in the blood? Transport oxygen, fight infection, or blood clotting. So the right option is blood clotting is the primary function of platelets in the blood. Which blood components play a crucial role in blood clotting to prevent excessive bleeding? Red blood cell, white blood cell, platelets, or plasma? It is very easy. The right option is platelets. Platelets is responsible for to prevent excessive bleeding. What is the function of blood in maintaining pH balance in the body? So the function of blood in maintaining pH balance in the body. Our options are the blood release hormone to regulate pH level, or blood absorb excessive acid from tissue. Blood transport bicarbonates ions to regulate pH, or blood produce enzyme that neutralize acid. Which one is the right option? So the right option is blood transport bicarbonate ions to regulate pH, due to which the blood maintains pH balance in the body. Which inherited blood disorder result in abnormal hemoglobin and Mcqs red blood cell? Hemophilia, sickle cell disease, thalassemia, or anemia. So the right option is sickle cell disease disorder result in abnormal hemoglobin and misshapen red blood cell. It causes the misshapen red blood cell. The right option is B. What is the term for the excessive increase in the number of red blood cells? Our options are anemia, leukocytosis, thrombocytopenia, or polycythemia. So the right option is polycythemia. Right option is D. Which blood disorder is characterized by a deficiency in platelets? Our options are hemophilia, polycythemia, thrombocytopenia, or leukemia. So the right option is thrombocytopenia. Right option is C. Is characterized by a deficiency in platelets. What does the top number in a blood pressure reading represent? Diastolic pressure, systolic pressure, mean arterial pressure, or heart rate. So the right option is systolic pressure. Systolic pressure is the top number in a blood pressure reading represent. What is the normal range for systolic blood pressure in a healthy adult? 80 to 100, 100 to 120, or 120 to 140, or 140 to 160. So the right option is 100 to 120 is the normal range for systolic blood pressure in a healthy adult. The right option is B. Which blood type is the rarest among the ABO blood groups? A, B, AB, or O? So the right option is AB, is the rarest among the ABO blood group. Which blood type is most common in general population? Our options are A, B, AB, O. So the most common blood type is O in general population. What is the condition characterized by a decrease in red blood cell or hemoglobin levels? Our options are anemia, leukemia, thrombocytopenia, or hemophilia. The right option is anemia. Which blood disorder is caused by a deficiency in clotting factor? Sickle cell disease, thalassemia, hemophilia, polycythemia. So the right option is hemophilia is caused by a deficiency in clotting factors. Which which blood cancer affects the white blood cell and impairs the immune system? Leukemia, lymphoma, multiple myeloma. So the right option is leukemia. Leukemia affects the white blood cell and impairs the immune system. What is the primary function of white blood cell in the bloodstream? Carrying oxygen, fighting infection and disease, initiating blood clotting, or regulating blood pressure. So the primary function of white blood cell is fighting infection and disease. The right option is B. Which blood disorder is characterized by an excessive production of white blood cell? Thalassemia, leukemia, hemophilia, sickle cell disease. So the right option is leukemia. Leukemia is characterized by an excessive production of white blood cell. Which of the following blood disorder is characterized by a deficiency of red blood cell or hemoglobin? Hemophilia, leukemia, thalassemia, or thrombocytopenia. So the right option is thalassemia. Thalassemia is characterized by a deficiency of red blood cell or hemoglobin. What is the term for a group of inherited blood disorders that affect the production of hemoglobin leading to anemia? Our options are hemophilia, sickle cell disease, leukemia, or hemochromatosis. So the right option is sickle cell disease. Which of the following factors can contribute to high blood pressure? Hypertension, regular exercise, low sodium diet, stress management, or obesity. Which of the following factors can contribute to high blood pressure? So the right option is obesity. Obesity is contribute to high blood pressure. What is the medical term for low blood pressure? Hyperglycemia, hypertension, hypotension. So the right option is hypotension. Hypotension is the term used for low blood pressure, while hypertension is term used for high blood pressure. Which of the following lifestyle changes can help in managing high blood pressure? Reducing water intake, decreasing physical activity, avoiding fruits and vegetables, adopting a balanced diet in excessive. So, which of the following lifestyle changes can help in managing high blood pressure? So, the right option is adopting a balanced diet and exercise. The right option is D. What is the diastolic blood pressure? The pressure during heart contraction, the pressure during heart relaxation, or the pressure in the arteries when they are fully expanded? Which one is the right option? Diastolic blood pressure. So, diastolic blood pressure is the pressure during heart relaxation. The right option is B. Which of the following is not a common complication of high blood pressure? Our options are stroke, heart attack, kidney damage, or low blood sugar. So, a common complication of high blood pressure is low blood sugar. The right option is D. Which unit is used to measure blood pressure? Millimeter of mercury, beats per minute, liter per minute, or milligrams per deciliter. So the right option is millimeter of mercury, mmHg. The right option is A. What instrument is commonly used to measure blood pressure? Thermometer, sphygmomanometer, stethoscope, or glucometer. So the right option is sphygmomanometer. The right option is B, is the instrument used to measure blood pressure. Which blood pressure reading is considered pre-hypertension? 90 to 60, or 120 over 80, 140 over 90, or 160 over 100 mmHg. So the right option is 140 over 90 is considered pre-hypertensive. In the blood group system, what does Rh plus indicate? Presence of Rh antigen on the red blood cell, or absence of the Rh antigens on the red blood cell, or presence of the Rh antigens in plasma, or absence of Rh antigen in plasma. What Rh plus indicates in red blood cell? So the right option is Rh plus represent the presence of Rh antigen on red blood cell. The right option is A. If both parents have blood type O, what are the possible blood type of their offspring? Or option only type O, only type A, only type B, or types A and B. So the right option is O, only type O. If both parents have blood type O, so their offspring must have only type O. If a person with blood type AB donates blood to a person with blood type O, what is the potential risk? No risk, it is safe for the recipient, or risk of clotting, risk of an immune reaction, or risk of infection. Which one is the right option? So if a person with blood type AB donates blood to a person with blood type O, there is no risk because it is safe for the recipient. Which blood type is often referred to as the universal plasma donor? A, B, AB, or O? So universal plasma donor is AB. The right option is C. Which blood type is known as the universal recipient? A, B, AB, or O? So the universal recipient is AB. The right option is C. Which antigen is present on the surface of red blood cell and blood type A? Antigen, A antigen, B antigen, both A and B, or neither A, neither B. So the right option is A antigen is present on the surface of red blood cell in type A. How many main blood types are there in ABO blood group system? 1, 2, 3, or 4? So the right option is 4. There are 4 types of A, B, AB, and O. These are the ABO blood group system. Which of the following blood types is considered the universal donor? It is very easy answer. We know its answer. Which one is blood type is considered the universal donor. So the right option is D. O is considered as the universal donor. Which blood component contain antibodies and plays a vital role in maintaining osmotic balance? Our option is red blood cell, white blood cell, platelets, or plasma. So the right option is plasma. Plasma play a vital role in maintaining osmotic balance. What is the function of hemoglobin in blood? Transport oxygen and carbon dioxide, initiating blood clotting, fighting infection, or observing nutrients. So the main function of hemoglobin is transport oxygen and carbon dioxide. Thanks for watching. Like, share, and subscribe.